So my name is Dr. Raj Krishnamoorthy. I'm a gastroenterologist based in Derby in the United Kingdom. And I've been a consultant for nearly 8 years now. And I see a variety of gastroenterology problems ranging from acid-related problems to tummy ache type problems, right to irritable bowel, and also patients with bowel inflammation, and also do a variety of procedures with endoscopy, where we diagnose a variety of things ranging from ulcers in the stomach right up to bowel inflammation and also bowel cancer. So that's a very passionate sort of choice because right from childhood, I was always interested in how people valued health, and that sort of slowly lit the path to chasing my passion and trying to help people. So it is very rewarding in many ways. So gastroenterology is a very varied specialty with a wide range of subspecialties, as we call it. So you have endoscopies, and also you have patients who are very unwell with liver problems who require emergency treatment, and also patients who require a lot of taking a lot of history about their symptoms in an outpatient setting. And I also have a special interest in clinical nutrition, where we see very complex patients with difficult bowel-related conditions, where we might have to provide artificial or alternative sources of feeding. So that's, the variety helps me to sort of engage very passionately in gastroenterology. So the most rewarding thing is talking to patients and listening to them, and listening to their concerns and their symptoms and exploring it and trying to find ways of trying to alleviate it. And patients value that as well, because they want a professional to go through their symptoms and give a valid explanation. So that's a very, very rewarding thing for me. Although there are things like procedures and other technical stuff, I find sitting down and talking to patients is the most rewarding thing. Yeah, it's patients appreciate a professional going through their concerns and explaining everything in very simple terms and taking time to explain them as well. So that is what I've found carries more and more value for patients from their perspective. Even though we do a lot of advanced tests and procedures, explaining them in very simple terms is what I think matters most for the patients.